At any stage in your professional career, a master's in health security can teach you how to prevent and manage public health problems and threats on a local and global scale. Students pursuing this degree gain the critical skills necessary to protect their communities from natural, accidental, and intentional disasters, including those which disproportionately affect the most vulnerable populations.
So the Department of Environmental Health Sciences is kind of the foundational piece to what might be exposure sciences as it relates to any kind of hazardous conditions in the environment. Whether that's a chemical exposure or like a hurricane. We look at the exposures there and we look at how to try to mitigate the risk against it. We try to understand the mechanism of injury going on with it and how to reduce the adverse outcome.
Dr. Stephen Murphy is a veteran of numerous major disasters. He's developed and managed preparedness plans and operational responses for environmental threats such as the COVID-19 pandemic, the Ebola epidemic, H1N1, hurricanes, and coastal oil spills.
Our program tries to leverage those lessons learned from the research, from the practice space, kind of leveraging those in addition to the 15 core capabilities produced by the CDC for public health preparedness, integrating that further into DHS and the national preparedness goal, the 5 core mission areas there with protection, prevention, mitigation, response, and recovery. And we try to create a well-balanced, multidisciplinary curriculum that allows the students to better position themselves upon graduation for entry into the preparedness space. Hey, Dr. Johnny.
Good to talk to you, Stephen.
Dr. Johnny, I was hoping you could maybe describe a little bit about what health security is and what this MS in health security, based here in New Orleans at Tulane, the oldest school of public health in the nation. I wonder if you could give us a little bit of insight into what that actually means and the importance of that here at Tulane.
Our program marries up the academic portion with the practical portion of this curriculum to ensure that as students move through the MS degree, that they're also able to understand how does theory, how does science apply to real life situations. In other words, this program gives the student a peek behind the curtain as to how does effective health security response and disaster management through the lens of public health occur on a global scale and a domestic scale.
And Dr. Johnny, could you elaborate a little bit on how the practicality of a degree like this, knowing the curriculum so well, and how we try to immerse the students in a learning environment that is beyond just the academic theory and the principles there, but immersing them into the actual reality of what an emergency operations center may be, the chaos that might be unfolding in that kind of environment. Can you talk a little bit about how this program might help a student learn a little bit more about the actual practice as they go through this degree program?
I think of it this way. An academic degree is the key that unlocks the door to future effective employment. But it's the experience that you gain and the learning that you gain through a program like this degree that allows you to move through that door. So whether it's practical experiences, walking through exercises in the classroom, learning about the theory behind scientific principles, or it's actually going into the immersive environment of something like an emergency operations center or a command post and seeing how all this blends together through the context of health security, that is what this program gives you, and it gives you a leg up as you enter the field and profession moving forward. I look at the concept of health security as the nexus between public health, medical, and public safety. And when you look at any crisis, whether it be a natural disaster like a hurricane, a man-made incident like an act of terrorism, or even a technological disaster such as a petrochemical facility releasing chemicals into the environment, every one of those crises is always going to have a medical and public health component. It's also why when we take a look at the FEMA community lifelines, those 8 absolutely critical lifelines that we have to make sure we continue, one of them is health and medical. And so in order to have an effective academic and practical background, you have to understand both the science and the practical natures behind the complexities of crisis response in any of those scenarios, and most importantly, the ability to effectively plan and how to respond to a health security crisis. And that is exactly what the new MS degree in this program offers?
Some of our curriculum is really active and really application-based. And so we try to introduce the students and leverage all of the research and the practice-based lessons learned that we experience over time and ongoing. And they have repeatedly commented on how it's better positioned them upon graduation to enter the job space and hit the ground running.